Hi, my name is Leah Reynolds. This is Legal and Ethical Issues in Healthcare, Module 3, Introduction to Law and the Judicial Process. Objectives. I will be discussing three separate case studies. Case Study 1, Assessing Standards of Care. Case Study 2, Applying Res Ipsa Loquitur. Case Study 3, Evaluating Negligence. Case Study 1, Assessing Standards of Care. In this case, medical records would include phone calls, documentation of the clinical visits according to Gurdo. Accurate and thorough documentation is essential to ensure continuity of care and legal protections. Clinical protocol and policies would include triage and symptom management policies and emergency referral guidelines. Diagnostic tools interpret and assess whether testing was warranted. Staff training and competency verification of critical as well as knowledge and skill set. Supplemental reports that may be requested would be undisclosed medical records, quality assurance reviews, updated test result interpretations, as well as expert opinion testimony. The previously disclosed medical records would include any omitted documents or those that were not provided. Additionally, the findings from the clinic's internal quality assurance review regarding the incident will be included. Expert opinion reports from medical and nursing professionals retained by the defense after the initial filing will evaluate the adequacy of the diagnostic test conducted. Furthermore, these records will help assess whether the clinical staff adhered to standards of care following national guidelines set by the American Heart Association. Deciding the standards of care. Review clinical guidelines, professional standards of nursing practice, scope of practice for nurse practitioners, policies, and protocols. The American Heart Association guideline highlights the importance of assessing symptoms like chest pain, radiating to the arm, diaphoresis, and shortness of breath, as they may indicate cardiac emergencies. Quick evaluation of electrocardiogram and cardiac biomarkers is essential for the patient at risk for acute coronary syndrome. The American Nurse Association emphasizes nursing standards of care that prioritize recognizing critical symptoms and providing timely interventions. In this case, the nurse could have improved patient safety by assessing the severity of the symptoms during the initial call and recommended immediate emergency care instead of non-emergent appointments that was scheduled. Nurse practitioners are crucial for thorough assessments and follow-ups. While ordering an EKG and a chest X-ray is a positive step, additional tests such as cardiac enzymes or stress tests, along with an urgent referral to the emergency department, would enhance safety. Effective triage protocols are vital for managing chest pain. Clear clinic policies should guide staff in handling reports of cardiac symptoms, prioritizing urgent cases, and ensuring follow-up. Reinforcing these protocols can significantly improve patients' outcome and ensure timely care. Deciding the outcome. Assess the duty of care. Evaluate breach of duty. Establish causation. Review evidence. Comparative responsibility. Clinic staff have a critical role in patient care, particularly when symptoms of potential cardiac events arise. Nurses may recognize warning signs such as chest pain radiating to the arm, diaphoresis, and shortness of breath, and promptly escalate care. If a nurse failed to meet the standards of care, this contributes to a patient's death. The court may rule in favor of the family. However, if the death is deemed unforeseeable or unavoidable despite appropriate care, the clinic may not be held liable. This emphasizes the importance of timely assessment and intervention in patient care. Case Study 2, Evaluating Res Ipsa Loquitur. The nature of the incident, excessive control, plaintiff's role. The fact that the case clearly justifies the plaintiff's reliance on res ipsa loquitur, the retention of the tubing and the subsequent harm to the patient create a compelling presumption of negligence. Despite the nurse's denial of any wrongdoing, the occurrence of such an incident in the context of a routine medical care unmistakably points to a deviation from the expected standard of care. Therefore, the plaintiff's reliance on res ipsa loquitur is not only warranted but strongly supported by the evidence presented. Absence of expert witness analysis. The retention of foreign objects such as surgical tubing is well within the realm of common knowledge because these objects are not expected to remain in a patient after a procedure. This fact supports an inference of negligence, eliminating the need for technical or expert clarification. Courts have consistently upheld that juries can reasonably determine negligence in cases without requiring expert testimony. In determining nursing's actions, we'll look at standards of care for drainal removal, documentation of procedures, inspection of drainal tube, training and competency of the nurse, timing of discovery and symptoms, and institutional protocols. Information regarding the proper technique and protocol for removing surgical drain tubes is essential. A comprehensive review of the nurse's documentation related to the drainal removal process will clearly establish whether the procedure was executed correctly. This includes the type of drain utilized, the method of removal, and pertinent observations. It is imperative that the documentation reflects whether the nurse visually inspected the tubing post-removal to confirm its integrity. As failure to do so contributes a breach of standards of care. Additionally, the nurse's training, experience, and competency in handling such procedures are crucial factors to consider. The timeline on whether the retained tubing was discovered along with the patient's symptoms during the 4 months following surgery and whether those symptoms were reported or acted upon will provide significant insight in potential delays in appropriate care. Moreover, thorough review of the hospital's protocol and procedures for drainal management and removal alongside assessments of institutional supervisory roles over staffs is vital for ensuring patients' safety and compliance with standards of care. Assessing for damages. Economic damages, non-economic damages. Yes, damages should be assessed. Damages in negligent cases involving medical malpractice, such as the retention of surgical tubing, should be assessed based on the type of harm experienced by the patient. Economic damages compensate for measurable financial losses and typically include medical expense, loss of wages, and future costs. Non-economic damages are awarded for pain, suffering, emotional distress, and diminished quality of life. In this case, the patient may claim for physical pain, emotional distress, and loss of enjoyment of life. Damages in this case should reflect both the financial burden and emotional, physical suffering caused by the retaining of the tube. Deciding the case. Application of res ipsa loquitur, breach of standards of care, causation and damages. To resolve this case decisively, it is imperative to analyze whether the plaintiff can convincingly establish negligence under the doctrine of res ipsa loquitur, and whether the nurse or the hospital has indeed breached the standards of care. The present facts and relevant principles lead to clear conclusions. Retained foreign objects after surgery are universally acknowledged by the court as an incident that invariably satisfies the criteria for res ipsa loquitur. To ascertain the negligence of the nurse, it's crucial to examine evidence such as whether proper inspection of tubing were conducted post-removal and adherence to hospital protocols. Gutierrez clearly asserts that nurses are duty-bound to follow established standards of care and procedures, preventing foreseeable harm to patients. The necessity of a second surgery to remove the tubing, coupled with the physical and emotional distress caused, provides irrefutable evidence of both causation and damages. Therefore, the facts overwhelmingly support a judgment in favor of the plaintiff. The element of res ipsa loquitur undoubtedly satisfied, and the nurse's failure to meet the standards of care directly resulted in harm. Additionally, the hospital can justifiably be held liable for the nurse's actions. Case Study 3, Evaluate Negligence. Analysis of damages, economic damages, non-economic damages, potential punitive damages. In this case, the patient suffered a second-degree burn, permanent facial scarring, and reduced vision in her left eye as a direct result of a surgical fire. To determine the appropriate damages for negligence, it's imperative to thoroughly assess the economic damage, non-economic damage, and potential punitive damages based on the established facts and legal principle. The compensation for negligence must encompass the patient's economic loss along with significant non-economic damages for pain, suffering, permanent disfiguration, and a reduce of quality of life. The injury has undeniably impacted her ability to engage in normal activities and diminished her enjoyment of life, along with its emotional ramifications. Unless there is subsequent proof, fraudulent concealment, punitive damage should not be awarded. However, the initial court decided to grant damages for malpractice is clearly justifiable by compelling evidence of negligence, as the surgical team failed to mitigate a foreseeable risk of fire associated with the use of supplemental oxygen and a Bovie instrument. Determining liability of the surgeon, nurse, or hospital or all. The individuals responsible for the damages in this case must be determined based on their role in the surgery, the level of control they had over the environment leading to the fire, and whether their actions breached the standards of care. Liability will be shared among the surgeon, the nurse, and the hospital, reflecting their respective contributions to the incident. The surgeon is the most liable party, having used the Bovie instrument near oxygen-enriched environments. As the lead in the operating room, he has an obligation to ensure safety of surgical procedures and is fully aware of the risks associated with an electrocardio device. According to Gutierrez, surgeons have a clear duty to grant patient safety during procedures and to prevent any avoidable harm. The nurse anesthetist also bears significant responsibility, given her role over administration of supplemental oxygen, which heighten the fire risks. It's evidence that proper protocol to minimize oxygen concentration in a surgical field may not have been adhered to. Additionally, the hospital can be held liable under the doctrine of respondeat superior, which ensures the employer are accountable for their actions of their employees while they are performing their duties. Institutions are responsible for ensuring safe working environments, including proper equipment maintenance and staff adherence to safety guidelines. Potential mitigation of liability. The defendants are well positioned to present several solid defenses aimed at mitigating their liability to the patient. These defenses will hinge on the specifics of the case, the evidence available, and the applicable jurisdiction. They could conveniently argue that the patient's own actions play a significant role in the injury. For instance, if the patient failed to disclose permanent medical conditions or behaviors that heighten the risk of fire during the procedure, the defendants can assert that the patient shared partial responsibility. Under the doctrine of comparative negligence, liability will rightfully be distributed according to each party's degree of fault. The surgeon is likely to contend that utilized the Bovie instrument correctly and that they were unaware of any increased levels of oxygen in the surgery area. Simultaneously, the nurse anesthetist can maintain that they adhere to proper protocol for oxygen administration and duly inform the surgeon of the associated risks. Expert testimony that contributes to defendant's compliance with establishment guidelines would further bolster that this defense. Additionally, the defense can strongly argue that the fire was an unforeseeable, unavoidable incident, that was not the result of negligence. Should they demonstrate that all necessary precautions were taken and the fire occurred nonetheless, they may significantly reduce or even eliminate liability. Furthermore, the defendant might assert that the injuries were not directly attributed to their action, but rather stem from other factors such as the inherent danger of using the ECOTD equipment in oxygen-enriched environment. It is also important to consider that the hospital and the equipment manufacturer could bear some liability. The hospital may argue that it is provided adequate training and established protocol, thereby shifting responsibility to the individual practitioners. If a defect in the Bovie instrument or the oxygen system contribute to the fire, the defendant could pursue a product liability claim against the manufacturer. Overall, the defendant have a strong array of defense to mitigate their potential liability. Determining the damages. Economic damages and non-economic damages. In this case, the court must decisively determine damages based on two categories: economic damages and non-economic damages. The objective is to thoroughly compensate the patient for measurable financial loss, as well as significant emotional and physical harm endured. Economic damages should comprehensively cover quantifiable financial losses, including medical expense, loss of wages, and future costs associated with rehabilitation, additional corrective surgeries, and necessary assistive device due to vision loss. Non-economic damages are equally important, addressing the intangible loss that the patient has suffered. This includes compensation for pain and suffering, loss of enjoyment of life, and emotional trauma. Psychological efforts of this incident, such as anxiety, depression, and post-traumatic stress disorder, must also be factored in. The court award should cover the patient's medical expense, lost wages, future costs, and adequate compensation for pain, suffering, and disfigurement. It is essential to strike a fair balance between meeting the patient needs and reflecting the defendant's level of negligence. In conclusion, in healthcare, adhering to standards of care is crucial for patient safety and preventing harm. Negligence arises when a provider fails to meet the standards, resulting in injury. The doctrine of res ipsa loquitur serves as a key legal tool when direct evidence of negligence is not available, but the circumstances clearly indicate negligence. Healthcare providers must maintain strict procedural protocols and thoroughly document to minimize risks and protect patients from preventable harm.